Hi, this is Dr. Pankaj Gupta. Thanks for having me here. It is a pleasure to be talking to this December gathering. And I'm going to be talking on healthcare IoT. This is a new and upcoming area. Not that the work hasn't been happening in healthcare IoT, but just because of the technology platforms coming to play as far as IoT is concerned, these areas in healthcare have got a new life, and there's a new area that has come to be labeled as in healthcare IoT. So I'm going to be talking a little bit about that. As you can see that, a visionary called Steve Jobs saw it that, the 21st century is going to be at the intersection of biology and technology, so a new era is beginning to happen. But we must give credit to Star Trek. Long back in 1980s, people who were growing up with me in those days would recognize what I'm talking about. This was a television series, and they talked about many of the things that we're talking in IoT today. And by the way, they had a bridge concept where all of these different things got connected, and they were able to talk to each other across humans, devices, and everything else. Now if you look at it, there are things which are happening. Let's take some examples of the IoT applications in healthcare, starting from the biomedical engineering side. And if you look at the devices and the biomedical equipment, there are sensors which are coming in the biomedical devices, and these sensors actually are able to monitor the equipment. They're able to throw alerts and reminders. They're able to see when the maintenance is due, when the bulb is near expiry, or they can raise the appropriate service request. They can log the request. They can also, follow up and say, hey, I need maintenance. You didn't come to sort of fix it and do the regular maintenance. So, different medical equipment is beginning to get connected to the platforms, and so all of that is beginning to get connected. Let's take the example of laboratory. In a medical laboratory, there is the RFID tags and the barcodes which are playing a whole lot of things on the lab samples. There is auto analyzer that is automatically analyzing the samples. They are doing automatic reporting. There are the CRM things which are connected. So the report is emailed to the patient. Alerts for abnormal values are thrown. Feed to the EMR, alert for the abnormal values given to the doctors. The CPOE concepts are also now getting connected to it, the drug-lab interaction. So if a patient is having, say, longer BP and CT, which is bleeding time and clotting time, and the patient is on blood thinners, the intelligence system will throw an alert and say, hey, doctor, you may want to titrate the medicine so that, the patient doesn't bleed to death. And these sort of things are beginning to happen because all the things are getting connected. And healthcare is a perfect area for IoT. Not that, this wasn't happening earlier, this was happening earlier also, just that with the advent of technology in the IoT space, this has become far easier than the client-server era. And, the reminders and the follow-up of lab tests and chronic diseases, those sort of things in the CRM space have got connected to devices. Let's take another example about patient safety and quality of care, barcode, medication, administration. So barcode is scanned at the time of dispensing the medicine, and then, again at the time of administration, the barcodes on the drug packets are scanned, and the barcodes on the hands of the patient are also scanned so that the right medication is going to the right patient in the right dose and the formulation and everything. Now, this is becoming possible because devices, things, humans, they're able to interact with each other using a platform. Next example being the bionics and the robotic surgery. Now these bionic areas are very interesting areas. Earlier they were like science fiction, but no longer. It's become a reality where physics and mathematics is playing very closely with biology and medicine to make things happen. By the way, the first Bionic Olympics is going to be held in Switzerland in 2016. I mean, this should be a very interesting thing to watch. Google Glass, that's another example which has happened. Very soon, the devices will start taking inputs by EEG. EEG is nothing but brain waves, and the brain will be able to control the bionic arm or things like that just by sending sensors. You can see an example. There is some research going on around that. And that's no longer just the sci-fi, it's reality. You know, we are very close to that, and many of the things which were lacking in this space will become even easier when the devices become smaller and get interconnected using the IoT frameworks and platforms. Robotic surgery is another similar area where a surgeon is sitting and doing the surgery. Now the surgeon doesn't have to be in the close proximity to where the surgery is being performed. Even the surgeon could be remotely located and still the surgery could be done. There is some more research to be done in that space so that the perfection can be done, but already robots are being used in surgeries, especially areas like plastic surgery, cardiac and GI surgery. Wearables, ingestibles, and implantables is another area which is worth mentioning when you're talking about IoT in healthcare. Well, the cardiac pacemakers have existed for a long time, but now they're getting intelligent. They're getting so intelligent that they're able to monitor the heart rhythm and then throw an alert if the rhythm changes. So any changes in rhythm, the alert is thrown by the cardiac pacemaker. Then there are wearable things like in an NICU where the baby is being taken care of, instead of putting a barcode on the baby's hand, it is tape which is sort of taped to the baby's chest so that the identity of the baby is established, and whenever the nurse comes to check on the baby, can scan the barcode and knows everything else that has happened for the baby, and no errors are to be expected, or minimization of the errors is at least something that can be expected. Google is working on the Google glucose sensing contact lens. Now this is a path-breaking thing, because if biomarkers can be monitored by using contact lenses, you really don't have to do a prick. And then if you don't sort of have to draw blood and do the testing, all that can be done from the sensors which are being sort of in the contact lens. A huge way forward. It's real-time data which is coming out. There's another thing which is happening, which is in terms of drug compliance. So drugs are coming with ingestible sensors. So every time a patient pops a pill, when the pill goes into the stomach, the sensor starts emitting some signal on a particular frequency, which can be picked up, and then the doctor and the health workers are sure that the patient has really taken the medicine and not really just said that I've taken the medicine. So the drug compliance definitely goes up. Similarly, drug counterfeit can be checked by using barcodes and RFID ink on the drug packages. All this data getting linked up with the HIS, EMR, and the PHRs, and they are also getting intelligent because appropriate actions and alerts can be done based on the inputs that are coming from these devices. So the world is beginning to get connected, and IoT principles are being used to connect all of that. Earlier, all these were islands, so devices were doing their own thing, software was doing their own thing, but what has happened is IoT has brought everything together. Another example is smart cities, emergency response. Now there are sensors where air, water and fever samples are being taken by the sensors regularly, and they are monitoring for any disease outbreak. So early warnings can happen for disease outbreaks. Past data is being analyzed to find disease patterns and accident patterns. Traffic sensors give early alerts of accidents. Also, the wearable devices and the smartphones are able to alert about medical emergencies. So automatic redirection of the ambulances can be done. Devices can shake hands and then establish the identity of the patient. The paramedic can start the treatment in the ambulance. The medical record can be communicated to the hospital. The hospital knows who is coming. So all of that is beginning to happen just because of the IoT framework getting implemented. Next example being the smart hospital. In a smart hospital, again very similar things like the smart city, but within the hospital environment. So the sensors are able to sense the air and the surface samples, and then they're able to see what is the infection load. If the infection load is higher than what it should be, the alert is given, and the appropriate action can be taken after that. Similar sensors are there in drapes and linens, and then in the sterilized equipment and the sterilized material, so that they know that the sterility of the material is sure, because the sensor will throw an alert if that is compromised. The building management system is another area. So the hospital building management system is beginning to get connected to the software of the hospital information system in such a way that the body vitals and based on the patient, the AC and the lighting gets adjusted, and the building management system sort of responds to what the patient's condition is. Smart beds. So the beds are beginning to get very smart, and the time is not far off when the bed of the patient will ping the mobile app of the doctor and say, "Hey doctor, this is Mr. Thompson's bed. You advise bed rest to Mr. Thompson, but Mr. Thompson's been moving around and he hasn't slept very well. He's been talking in the bed." So that sort of information could get relayed to the doctor. I mean, it's a little bit of thing in the future, but I thought I should mention that is possible. It will happen sometime. Smartphones and wearables. You can see that whole set of wearables are emerging. Earlier they emerged for sports, but then now it's being used for healthcare extensively to monitor the blood, the heart, the weight. They are also available for cancer patients, for nutrition, and then all those sort of things. All these devices are getting connected using the smartphone, and it is available to the patient, and then it's something that the patient can see in his smartphone, that what are the readings, and the meanings are beginning to become available. So all of that are examples. These are well-known examples. I really don't have to talk about each one of them, but I just thought it should be mentioned. Telehealth and remote care is another area where existing technologies are coming together so that the doctor can remotely diagnose the patient and also start the medication so that the patient can be taken care of. And there are devices becoming available like the telepresence, where you have the electronic medical record and the diagnostic devices coming together with the electronic medical record to make sure that everything is taken care of in one single device. The data is beginning to grow rapidly, not just the velocity of the data, but the volume of the data and the data variety. If you look at the data variety, it is all sorts of data: photos, web, audio, mobile, structured, unstructured, video, social media. Now, social media is beginning to contribute a whole lot, and that is going to be sort of play a vital role going forward. So all this data needs to be sort of put together and analyzed. From a healthcare perspective, when you look at it, then how do you do it? So you'll have to sort of bring all that data into cubes and analyze it, and that analysis itself is creating a whole lot of opportunity for healthcare organizations, and people are beginning to call it the big data. Some people even call it the data lake and things like that. However, I believe that for this to happen in real time, in the perfect way, the platform is yet to emerge. I am again reminded of the knowledge bank of Star Trek, and then there was a latest movie from Avatar, the Steven Spielberg movie, in which they had the concept of neural network. There was a tree of life, everything getting connected. It's a network of everything. Now, for that to happen, platforms need to emerge. I saw latest news items where the super brain is being developed, and that is beginning to control the machine using the brain-machine interfaces. So those sort of things are the new things that will come up going forward. All the data points, smaller data points, come together to basically give the big data. So that platform, standardized syntax, semantics, the registries have to emerge, the metadata has to be used, so that all of them, all the different applications that are getting connected, all the different devices that are getting connected, cannot be expected to have the same standards. So whatever standard they are on, the platform should be able to take that data and connect it using metadata standards. So that's beginning to happen, but more research is required, more development is required in that space. The leaders who are actually sort of at the cutting edge of that platform is, I would say, Apple, Google, and Samsung right now. I see them as the front runners, developing platforms specifically for healthcare. But again, as I said, more needs to be done. They're on the right path, but still there's a lot to be done as far as standardization of the syntax and the semantics is concerned. Syntax is still done, but semantics in terms of the context as to what data gets merged with what other data, is it the same meaning or different meaning? Okay. The second line challenges are Qualcomm and Amazon. They are also beginning to do the same, building platforms for IoT. But as far as healthcare is concerned, they have a little way to go and challenge the leading players like Apple and Google. When you look at the traditional players, they are looking at IoT as from the same lens as they've been looking at everything else. But what needs to be realized is it's a whole new world, whole new animal, and you need to do a complete rethink. There are new players building the IoT platform, and then it's good to mention that one called ProMed Network AG from Switzerland and Germany, which is funded by the plastic laser guys. And then you have the others like Stanley, HP Aruba. It is important to mention McKesson, which is a wildcard entry as for me, but I call it wildcard because it's an established player as far as the EMR is concerned, but quietly they've been working in the background to build a platform for IoT, and getting all the different stakeholders connected. Well, Cerner is doing the same by building alliance of all the players in the market called the Commonwealth Alliance. And there's another alliance of the similar nature called Continua, and that is happening with the Intel and other guys sort of coming together. But Commonwealth is something which we should look forward to, because all the right sort of players are beginning to sort of put the standards in place. And when these big guys come together, something happens. Privacy and security issues, these are important to consider. The flip side of IoT, and we need to make sure that we're not violating the privacy and security. The important thing to consider is that computing network infrastructure can deal with security, but privacy is a policy matter. So that's where when humans come in and the human eccentricity comes in, that's when the weakest link of the chain breaks. So the people are the weakest link, as it's said. So that's where you have to be careful about IoT and not blame the technology because the people didn't do their job properly. In terms of policies and procedures being laid out, like a lot of things are being discussed in different parliaments and congresses of the world, but they're dragging their feet to pass some of those laws so that IoT could be sort of taken care of. But again, that is something to keep in mind. HIPAA has been there for a while, so let's talk a little bit more about how HIPAA can help there. Healthcare infrastructure, that's important because when we put IoT out there, the load on the healthcare infrastructure goes up significantly. And that load needs to be taken care of, and you need to put an infrastructure that can take all of that within the enterprise and outside the enterprise. Within the enterprise, wherever you need to do Wi-Fi, that Wi-Fi should have a sufficient bandwidth. And then within, and if you have to host it, you have to make the decision about how you're going to connect the hosted site to the hospital and the other healthcare centers. Many players, like in India you have Reliance Jio, and then globally you have things like Qualcomm, Verizon, and Comcast. They are putting healthcare IT platforms that are able to connect to any network like 3G, 4G, CDMA, GSM, Li-Fi. Li-Fi is the latest one which is emerging, and ISP and MPLS. Of course, there are new players that are IoT specialists that will emerge and that are emerging on the scene. I did mention about some of them, and that's a very important thing to sort of keep in mind, that there are new infrastructure players that are emerging with the specific of IoT, and it's required. In terms of HIPAA, data privacy, it is important that the privacy is kept private, and it doesn't happen that because everything is connected, the information lands up at somebody else's desk or somebody else's phone or tablet just because everything is connected. The privacy should not be compromised. To do that, the most important thing is to have registries of the patient, registries of the physician and the facilities and everything, so that when the data is exchanged to the IoT platform, it goes through the exchange and it makes sure that the registries will take the data to the right person and not violate the privacy of the patient. In terms of transaction and code sets, it's very important that the syntax and the semantics is correct when the integration happens. Now, you could do the integration technology level, but when it comes to syntax in terms of say diabetes really means diabetes, and myocardial infarction really means myocardial infarction. If somebody says coronary atherosclerosis or CHF, the systems don't sort of start figuring out that these are different things, but actually these are pretty much similar or same things which are related, and so that's where the syntax becomes important. Accordingly, semantics are important because the context in which it has been said, that is also very important. The network security and the data security. So healthcare IT is fraught with network and data security concerns. There are reports that a former U.S. vice president feared the worst and he got the Wi-Fi switched off for his pacemaker. His concerns are not unfounded. That's really possible. Compromises are possible. Devices could be the entry point for the wrong set of people who want to compromise the data, or they want to have access to your data, or just create error, as simple as that. So that could become the entry point, and that needs to be guarded, and that's where it is very important that you have the network and the data security layers perfectly done in any IoT platform, and don't underestimate that at any stage. Physical security is accordingly important because authentication, authority, and audit, these should be built into it. So authentication being that the person who is coming in is the person who actually the person is, and the device that is getting connected is having the right authority to get connected, and the audit layer is there in place that if any data is changed or any data is added, then the audit log will tell you as to who did what at what time and what was changed. Health information exchanges will begin to happen. IoT is leading towards that in terms of all the data getting exchanged through the platform. So metadata-based integration will happen, and going forward, the integration layers need to be cognizant of that. So the metadata is something that is going to play a very important role. Accordingly, the registry of the patient, the disease, and the documents will become important so that identity crisis doesn't happen. So we are moving from an obsolete to a transformative leadership, and to do that, we have to be cognizant that there are incremental improvements that need to be done at the same time, but at the same keep in mind that take a quantum leap forward, and then may take some baby steps to make sure that you're going in the right direction. I'll stop at that, and I have basically said everything I wanted to say about healthcare IoT. And usually I stop at the quotation given by Florence Nightingale, because beautifully what she said was that you can do all the treatment that you want to do, but the most important thing is the overall environment that heals the patient than anything else. Thank you.